Did you know that in Singapore, about 1 in 20 school children has a food allergy? That's roughly one child in every classroom. Common foods that most of us enjoy without thinking can trigger life-threatening reactions in some people. Understanding what food allergies are, recognizing their symptoms, and knowing how to respond can help you save a life. Let's start with understanding what happens in your body during an allergic reaction. The job of the body's immune system is to fight off germs that make you sick, but sometimes it gets confused. A food allergy happens when your immune system mistakenly attacks a harmless protein in food. However, not every bad reaction to food is a true allergy. Sometimes there's actually a food intolerance. Food intolerance doesn't involve the immune system, and symptoms tend to appear gradually, often only after consuming a larger amount. It happens when the digestive system struggles to break down certain foods. Common symptoms include nausea, cramps, bloating, gas, and diarrhea. One well-known example is lactose intolerance, when the body doesn't produce enough of the enzyme needed to digest lactose, the natural sugar found in milk. Now let's get back to food allergy. There are two main types, immediate and delayed. Immediate food allergies usually show up within minutes to 2 hours after eating the trigger. You might get rashes, swelling, stomach pain, or vomiting. In serious cases, it can even cause breathing difficulties or loss of consciousness. Delayed food allergies, however, take longer, hours or even days to appear. These may cause blood in the stool, vomiting, stomach pain, diarrhea, and even faltering growth. So what are the most common food allergens? The top 8 food allergens are eggs, cow's milk, peanuts and tree nuts, shellfish, wheat, soy, fish, and sesame. Now that we know which foods can trigger a reaction, let's take a closer look at what actually happens during an allergic response, specifically an immediate one. Allergic reactions are unpredictable. While most are mild to moderate, they can sometimes become severe and potentially life-threatening. And this can happen at any time, even if previous reactions were mild. That is why knowing what to look out for and how to respond is so important. In a mild to moderate reaction, the child may develop an itchy or tingling mouth, hives, itchy red bumpy rashes that look like mosquito bites, swollen face, eyes or lips, abdominal pain or vomiting, or a sudden change in behavior, becoming less active and quieter. If you notice any of these signs, stay with the child and monitor them closely. Give a dose of antihistamine and watch for any new or worsening symptoms. It's important to remember, a mild to moderate allergic reaction can quickly become severe or even life-threatening, even if it hasn't happened before. In a severe reaction, also known as anaphylaxis, the child may have airway or breathing difficulties. You might notice a persistent cough, hoarse voice, difficulty swallowing, a swollen tongue, difficult or noisy breathing, or wheezing. They may also look pale or floppy, suddenly become sleepy, complain of dizziness or faint, signs that the blood pressure may be dropping. If you see any of these danger signs, positioning is key. Lay the child flat on their back. If they are having trouble breathing, allow them to sit with their legs outstretched. Never let them stand or walk. Hold young children flat, not upright. Use an EpiPen if one is available, and call 995 for an ambulance immediately. And remember, when in doubt, use the EpiPen.
If my child develops a swollen face and hives all over, do I give antihistamine and just observe?
Yes. Even though swelling and hives can look alarming, they're still considered a skin reaction. Give your child an antihistamine and keep a close eye on them.
What if I'm not sure whether it's an anaphylactic reaction?
When in doubt, it's always safer to use the EpiPen. Delaying treatment for anaphylaxis can be dangerous, and undertreating is riskier than overtreating.
What if I use the EpiPen and it turns out my child wasn't actually having an anaphylactic reaction?
Don't worry. Adrenaline is a hormone naturally produced by the body. Using an EpiPen unnecessarily isn't harmful. It might cause a brief increase in heart rate or some trembling, but these effects will pass on their own. Remember, food allergies can be serious, but knowing what signs to look out for and how to respond can truly save a life.